Okay, so I'm going to talk to you a little bit about caffeine. It's funny, in the last couple of days, I've talked with people that drink a large amount of caffeine. A couple of my friends on Facebook joined a group for fans of coffee. So I'm just going to talk a little bit about how caffeine impacts ADHD and vice versa. You may find that when you have ADHD that you have a higher intake of caffeine than other people. There's a couple of reasons for this. One is that caffeine is a stimulant, and it can help you focus. The other thing is that sometimes when you're ADD, you're a night owl instead of a morning person. So if you have a morning job, you may drink some caffeine to make sure you wake your brain up in time for work. The other thing is that caffeine wears off. So if you go through caffeine withdrawal, which can be pretty nasty, you can get headaches and nausea. You need to have more caffeine in order to make that withdrawal feeling go away. And so when you have ADHD and you intake caffeine, the caffeine helps you focus only for about 30 minutes. And again, the side effects of withdrawal are pretty nasty. If anybody that's gone cold turkey from coffee can tell you. So you just want to be really careful. You also want to be really careful if you're taking any medications for ADHD. You want to watch your caffeine intake because caffeine works on your central nervous system just like the medications for ADHD. So you really want to let your doctor know how much caffeine you're taking in per day. And your doctor can let you know if they feel like that's too much, and they can help you kind of regulate it. So, and if you're feeling like you want to cut back on your caffeine, again, talk to your doctor again because you may not want to go cold turkey and just stop it altogether because of the icky side effects, especially if you're a chronic coffee drinker. And also TS caffeine. A lot of other things have caffeine, like Sarkis soda's got caffeine in it. So you just want to be really careful and kind of check labels. And of course, soda has caffeine in it unless it says caffeine free. Chocolate has caffeine, and also there's more caffeine in dark chocolate than milk chocolate. So there's little places where we get caffeine that we may not think of it. And again, it'll help you focus, but only temporarily, and the side effects are from withdrawal are pretty nasty. So again, if you've been drinking coffee from an early age and drinking a lot of coffee, you might want to check into whether you have problems focusing because, again, the caffeine acts as a stimulant.